Let's start with the first is why did you choose to be a penile prosthetic surgeon? So how would you explain penile implants to a layman? So if somebody comes to you, how do you handle these guys with unrealistic expectations? What do you usually offer men before you take them up for an implant? So what has your experience been with PRP? So do you also believe in giving them testosterone replacement? What opinion do you have about their implants? In which patient would you always choose the malleable?
So, by the way, before we start, I wanted to tell you that I've been watching your videos, and I appreciate the work you're doing. I think you've been doing that for quite a long time.
Yes.
And as I heard from Eve, you are doing very big numbers of those patients. And I know how time consuming it is, not only to do the surgeries, but to take care of the patient before and after. So I wanted to tell you that I am impressed by the volume of implants that you are doing.
Thank you so much. But this has more to do with India. We are a big country. So in population, we are huge. So we are
Yeah,
very dense. So we have a lot of people living and
yeah,
because of the aging population, we have people who are now, our demography is moving into the 40s and 50s. So erectile
yes,
dysfunction is going to be a big, major problem in the coming years. So I always tell Rigicon, and also I used to tell AMS that in India, we have almost 1 million heart stents, cardiac stents
oh
that we
yes,
place every year.
every year.
And 1% of those men will definitely require a penile prosthesis. So
So it's 10,000.
we are looking at big numbers.
Yes,
But we have to bring that confidence in our
yeah,
patients that this is actually a good option, and
yeah,
I think it's better than taking medication. So
for sure.
because medication is never spontaneous. So with medication you always have this: it will work, it will not work. But with the
Yeah,
implant, you are sure that it will always work.
yeah, no anxiety.
Yes. So I think many people appreciate that after the surgery.
Yeah, sure.
So Dr. Bailey, can we begin with the questions?
Yes, please.
Okay. So let's start with the first is why did you choose to be a penile prosthetic surgeon? So as a urologist, there's much more easier ways to establish a practice. You can go into stones, you can go into oncology, but doing prosthetic urology is difficult, convincing patients, doing the surgery, and then it is a mix between surgery and cosmetics. You have to also give results. It is very frustrating sometimes when patients complain about sizing and recovery. Why do you want to take all this headache, and what made you go into prosthetics?
Um, I choose men's health, medicine and surgery, and especially penile implants procedures as a subspecialty because I wanted to address what I was seeing as a resident being a growing problem, which is the problem of erectile dysfunction and how much distress it was causing to the patient. And I witnessed also that most urologists were not taking care of this problem. We were taking care of cancers. We were taking the prostate of these men out because of cancer, but we would let them living their life longer, of course, but without any sexual enjoyment. And they were left alone, those patients, in a great anxiety. So I decided to take care of that problem, and decided that I wanted to help those men.
Okay. So so like most prosthetic surgeons, it's your feeling to help out men, right? So helping
Yes,
men become men again,
yes,
just
exactly.
not make them live longer, but live delightfully.
Yes, that's
Live.
that.
Okay.
Yeah, that's
Um,
the thing.
so so you talked about penile implants, and obviously this interview is about penile implants. But imagine that I am somebody who has no idea about implants, and I'm
Yeah.
somebody who has no background in science or medicine. So how would you explain penile implants to a layman? So if somebody comes to you, how would you explain what these are to a layman?
Uh, I would tell to that guy coming to me that the penile implants, it's an invisible device that I will place inside his penis, that's going to help him to achieve rigidity again. This is no magic. This is no improvement in size, no improvement in sexual drive. It's only one device that's going to help him to recover rigidity. And I would explain to him after that how much this little detail, being able to be rigid again, is going to change his life regarding the self-confidence he has and the quality of life. So I would explain to him that it's a simple device, invisible device that will stay inside his penis.
So when you get patients in your outpatient who come to you for a penile implant, and you get a lot of guys who are who come to you and say that I want to become big and I want to become strong and I would want to have sex maybe 4 times and I want a lot of timing. How do you handle these guys with unrealistic expectations?
Yeah, so it's a very important moment in the clinic before placing penile implants to set the expectation in a realistic range. So I tell them that they might be longer when they are flaccid after the penile implant is placed, but they will not be longer when they are erect, because the disease that cause the erectile dysfunction, it could be diabetes, it could be uh, heart failure, it could be cancer. This disease has taken already length from their penis. So what we can do is try to minimize the consequences of the disease by using a vacuum pre-op. What we can do also is, as big numbers of penile implant surgeons like you and I, we can maximize the size of the cylinders that we are going to use, unless the doctors who are not doing that much procedure, we are used to it, we can maximize the size. But what we cannot do, we cannot add more lengths than they have. We cannot add the girth with a simple implant. So the goal is to set up the expectation to make sure that the patient is going to be happy. If we, in the contrary, if we let those questions unanswered, or if we let the patient figure out himself what the result is going to be, we have a high risk of a patient being unhappy, even though the surgery was a success.
Okay. So off the question a bit, you talked about preoperative improvement like using a vacuum pump. So what do you usually offer men before you take them up for an implant? Like, do you give them a period of rehabilitation or do you take them up immediately?
Yeah, well, I like the concept of penile rehabilitation. When those patients are not that much in a hurry, I tell them to work with a vacuum for a month or two pre-op, so
Okay.
that they are going to exercise daily for 30 minutes, trying to maximize the size of their penis when they are fully erect in the
Okay.
vacuum.
Okay.
And I will encourage them to take tadalafil 5 milligrams daily for the, the, the first weeks when we decide to do the surgery to improve the vascular function, the local vascular function. And also those who had fibrosis from priapism, for example, or from a previous implant removal, will add to this regimen some PRP shot inside the corporas.
Okay.
This also to maximize the 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 chances we have to maximize the size.
So I usually use P shots for my patients too, and I have
Yeah.
seen some wonderful results with them. but a
Yes.
lot of professional bodies still call them experimental. So what has your experience been with PRP?
I love the PRP. Actually, I'm one of the, if not one of the biggest, maybe I'm the guy who's doing the biggest number in France. So the thing is, I totally agree with you. When you are selecting the patient the right way, and you are using P-shot for ED in patients who have endothelial dysfunction, like the guys we just talked about previously, the guys who come from the cath lab to get a stent in their coronary arteries.
Yes.
These patients, they can have erectile dysfunction only from a slight problem, which is endothelial dysfunction. And the PRP is going to be a very interesting solution for them. It could be to improve their their erectile function for once and for all, or it could be only to prepare them to get the implant in the better conditions. So PRP, in my opinion, is a major tool in our arsenal.
Okay. So do you also believe in giving them testosterone replacement before going for an
Yes,
implant?
yes, that's another thing. Actually, we know that the patient who come to us for a penile implant because they have erectile dysfunction, most of them suffering from this erectile dysfunction, they turn their back on sexuality. They don't get that much sex drive anymore because they feel ashamed because it's not working. They are living conflict with their wife because of this problem. So the amount of testosterone they are building is getting down and down year after years because they are waiting without any solution. So it is part of my routine to assess the situation hormonal wise and to replace the testosterone which is lacking when that's the case.
I think you are giving a very exhaustive preoperative solution to most of your patients. And again, this is why I think we should always go to a high volume center, because a doctor is just not focused on, just cutting and putting in the implant. He's more focused on giving you a good preoperative so that he can maximize the results inside the OT.
Yes,
Okay.
definitely. That's a major
The reason for a
improvement
high volume center.
for high volume centers. It changes everything.
So now, question about the Rigicon. So the Rigicon revolution is here. The Rigicon is a new kid on the block, the new company, but which is making excellent implants. So I have switched over 90% of my practice to Rigicon, and I've heard that you've also been using Rigicon frequently. So what opinion do you have about their implants?
Um, the thing Rigicon is doing now is they are mixing the good sides of the already existing devices. So they are coming to us with new implants that are answering the problem that we were talking about to the previous builders of implant, to the previous companies. So as I was able to witness, like you did, is that those guys, they are coming to the doctors with the devices we were waiting for, uh, with a pump easy to use, with cylinders who are able to inflate lengthwise and girthwise, but doing that still having a good rigidity, uh, with a semi-rigid implant, which is fitting perfectly with the anatomy of the patients, and with devices who are coated, ready to absorb antibiotics to lower the risk of infection. So
Okay.
they are bringing the solution we were waiting for.
So I'm a big fan of their malleables because I feel that their malleable is a very good balance between concealability and rigidity,
Yeah,
and it's
yeah,
a very comfortable malleable. So do you think you have
yes.
the same opinion about their malleable?
Yes, I think we all have the right patient for the different kind of implants, and Malleable is bringing faster recovering. It is bringing no need for maintenance when you are doing the surgery and you live not that close to your surgeon, when you want to travel after your surgery, or when you live away from your surgeon. Plus, it's giving a very good stability of erection at time of sexual intercourse, and it's very rewarding for the patient, because the patient will feel the device is adding to his to the strength of his penis. So I feel those malleable penile implants are a very good solution for erectile dysfunction.
Okay. Uh, so if a patient comes to you and he says, Doctor, you choose the penile implant for me, in which patient would you always choose the malleable?
I see that we have some patient in common. Those patients
Yeah.
coming to us telling me, you tell me what I need.
Yes.
Actually, the use of hydraulic penile implants, it has the main adding that we get from these devices. It's when it's deflated, it's a little more discreet. But apart from that, I will tell the patient, we need something that you feel comfortable with, something that's going to be easy for you to use. So I will assess the situation regarding his anatomy. Is he obese or not? Is he skillful with his fingers or not? Then I will ask him, what does he want to do with his penile implant? You know, if the guy wants to go out and he has no wife yet, and he wants to meet new girls, and maybe hydraulic will be more discreet. But if he's already in a situation, he's living with his wife already, there's no need to be that much discreet. His wife and him, they already know that the guy had the erectile dysfunction. It's not new. And so it will not be awkward that the guy has a device inside his corpora. So if I feel the patient might have difficulties to recover, to heal from his wound, I will also tell him that the malleable will be a very good option. So I think we have patients for all the kind of devices, but the malleable is a very useful gun for us.
So you are actually in the middle of the East and West divide. So what I have noticed over many years is that surgeons from the US will always and always choose an inflatable. And the surgeons from the Middle East and from India, we tend to use the malleable more. But I think that you are giving a due consideration, for the patient, whether he needs
Yeah.
an inflatable or a malleable. I think that's a good thing. Does
Yes.
the like you mentioned about the wife and the partner, uh, a very common question that we get from patients is that I am going to be with a younger woman and I need to be more vigorous, or I need to be. So does that
Yep.
decide your choice between an implant?
Yes. The thing is, when we have patients who are about to meet a younger woman, or who already married a younger woman, one of the main problems they will get when their erection tends to be fragile or to be deficient is they fear that their wife will not accept them anymore. They will see them as old men. The thing is, unlike the medications, when you are wearing a penile implant inside, you can be confident in the solution that you choose, because whenever she wants, you have the possibility to satisfy. You can answer your wife asking you for sexual intercourse. You don't have to take a pill, wait for the pill to be effective, hope for the pill to be effective long enough. So penile implants are the good solution for that problem, because even though your wife is young and she's going to ask for sexual intercourse, and she might ask at any moment, you know that you have the solution. So you are peaceful. You know that you can ask the question.
Hey kid, don't ever let them get inside your head. They'll tell you what to do in life instead of everything you know that you could get. Don't let them guide your life towards regret. I'll fight for what I love with every breath. My past is filled with things I won't forget. I use them all to push me to my best.